This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, I am Rachel Reeves. I'm one of the PGY3s at Beaumont Taylor. This is the Beaumont Taylor PM&R program, not the Beaumont Royal Oak. There are two, so make sure you're careful as to which one you're talking about. I'm originally from Arkansas, and I went to ACOM as a med student, so I saw a few ACOM people on the thing. I don't know if my coordinator is here tonight, but I'll try to answer chat questions as best I can. So we're Beaumont Taylor. Let's see. So these are our attendings kind of squished up here. Jonathan Ho right here is our new program director. He took over this year. We have two brain injury fellowship trained physicians, Wendy Contreras and Riley Smith here. We also have a neuropsychologist on board, Dr. Roscos. Let's see if it'll go. It's not letting me. Oh, okay. These are our two chief residents. Unfortunately, we do have some people out with COVID. So one of our chiefs is on an airplane. The other one has COVID right now. So fun times. All right. These are our current classes. As you can see, our fourth year class only has 4 people. We are now a 5-person per year class or program. But the PGY3s, which is my class, we were the first ones with 5. So we're still growing into that a little bit. All right, so we are a categorical program. We do have 5 residents per year. We are the only brain injury medicine fellowship in the state of Michigan. We do have full accreditation and no citations at this point. We run a 49-bed rehab unit. We also have a 14-bed TBI unit. It is a secure unit, so you can only badge in and out of it. All the beds are actually private, so it works really well for TBI patients. We also do have a very multicultural population in this area as well. We're pretty much right outside of Detroit, kind of Taylor, Dearborn, Trenton, and Wayne are the hospitals that we go to, but we're all kind of right outside of Detroit. And these are all of our hospitals. So the top one is Dearborn, which is a level 2 trauma center. This is Trenton, and then the last one is Wayne. So we do see quite a few traumatic brain injuries. We do see some spinal cord injuries, multiple traumatic injuries because of the level 2 trauma center, spine and hip fractures. We do see a lot of MS. We've seen quite a few Guillain-Barré in the last year as well. We're dealing still with some COVID patients, and which are typically, a lot of them end up critical illness myopathy for us, and quite a few amputations, but I think that's pretty common. Outpatient procedures. We do have a lot of interventional pain, baclofen pump. I actually had to fill one the other day in consults, so we see that quite a lot. Botox injections, EMGs, trigger points, kind of all that. All right. So our PGY 1 year has 5 months of internal medicine and ICU, but we also have the ability to kind of choose our electives. So, they're chosen for us, but they're specific more for PM&R. So we do a neurology rotation, we do a neurosurgery, orthopedic surgery, and radiology. We also do a month that's split between geriatrics and rheumatology. So we kind of get to see all of those things to help prepare you for your second year. And our second years are pretty heavy inpatient year. So we do a lot of inpatient, 9 months of it. We also do 2 months of a consult service at Dearborn. And we also have a neuropsych rotation. So we work closely with our neuropsychologist, seeing patients on the floor and outpatient to see kind of their testing. Our PGY 3 and 4 years are much more robust, if you would say. They're a lot more outpatient, still doing consult service, but we're in clinic at this point. We're also doing interventional pain, ortho. We are now also doing pediatric rehab. We are now doing an inpatient pediatric rotation in the pediatric hospital in Detroit. We also do a month with the VA to help get EMGs, and then we get to choose kind of an elective month. PGY4, we still do a lot of the consult service, but we actually start doing consults more at Trenton and Wayne rather than just Dearborn. So we get to see a little bit different how some of our sister hospitals actually work with their trauma services as well. And this pediatric rehab rotation in PGY4, we typically and historically have always done PEDS rotation as an outpatient rotation. We're now doing a month of inpatient and then a month of outpatient. So that's why we have a month in PGY3 and a month in PGY4. That's a new change this year. We've had quite a few of our residents go into fellowships. We've had somebody go into Mayo Clinic, Harvard Sports Med, and brain injury. One of our most recent ones was actually DMC pain. That was last year. And there's another one. Georgetown MedStar has been pretty recent, and Cleveland Clinic Sports and Spine is also, I believe that was last year as well. So we've had quite a good success in fellowship matching. All right, so the fun stuff. We get 20 days of vacation a year. We get 5 conference days, and then we get 7 interview days as a 4th year. You can see Oliver. I haven't seen all these pictures, sorry. We also get a stipend. It's a little bit more for PGY 2s and 2s through 4 than it is for our PGY 1s. Pretty much our PGY 1s use it for boards. We also do get a food stipend every year. At Taylor and at Trenton, we have food in our resident lounge. That's not necessarily the case for Dearborn, but there's always hoping. There's also a lift service if you're very tired or just worn out and don't feel safe driving. The lift service will take you home and they will bring you back to work the next day. No charge to you. Didactics. So we hold didactics every Tuesday from 8 to 10 a.m. Well, 8 to 11 really. We're now adding in some board review, but we're holding off for the first couple months just to get kind of our newest second years and our first years kind of involved again. We're also kind of changing up how we do our journal clubs, but we're going to be doing 12 this year. We also have to have the M&M conferences. That's an ACGME kind of requirement. We're getting more EMG and ultrasound workshops. We are also starting grand rounds this year. And then we've been doing mock oral boards for several years now. We were also trying to beef up our wellness curriculum, but it's been difficult with COVID, as I'm sure some of the other programs here can attest. All right, so why Beaumont Taylor? So as our program has grown, we've started to kind of, I guess, become more of a family as well. Our residents are very close. We hang out quite a bit. I actually went to brunch with a couple of people yesterday. We have plans for going kayaking next week. If you've ever been to Michigan, the summers are great, but the winters suck. So we're trying to get the most out of the summer right now. So we're going kayaking. So really, I think that's one of the things I've loved most about Beaumont is just the relationship between all of the residents. I would also say that our faculty is pretty good. They're very approachable. They like to joke around with us too, which is nice. It's not all work all the time. I also like that the Beaumont Taylor, the hospital that we're actually in, most of the time is more of a community hospital rather than kind of a level 2 trauma center that's busy and very academic. We're a little bit more of a community-based hospital, which for me was a huge draw because I like kind of the smaller hospitals. Here's all of us at graduation this year. Everybody actually looking to find us, and I don't think I've ever seen everybody without a mask on until that day. So that was pretty fun. We are very close to Metro Detroit. We're actually about 20 minutes outside of Detroit. If you are a big sports fan or like music, this is kind of the place for you. You're going to see a lot of it. There's a lot of different food. There's a lot of different things to try in the area. There's also, we've got winter and summer sports because we do both seasons. And here's a map. So Taylor is kind of right here. Dearborn's in this area, and Detroit is here. But you can accidentally slip in Detroit just going down the interstate. So we're extremely close to them. There's also like the Upper Peninsula. If you really want to drive over there, we've got all the Great Lakes around us. Now that the border's open to Canada, you can actually go into Canada pretty easily. We've had one of our residents accidentally go into Canada, not realizing that the exit was had changed. As I said, lots of sporting events, hockey, basketball, baseball. This is us at the baseball game last year. A lot of the guys like to go golfing. Kayaking, which we've been doing. We've also done quite a bit of hiking, mostly because it's outside and there's less chance of spreading COVID. I'm not good at snowboarding, so I've not done that. Always lots of food. We're always trying new places, especially now that COVID's kind of, I'm not going to say it's over, but it's decreased a little bit. We've been trying a lot more new restaurants around the area. There's always a big, really big Christmas tree in downtown every year. Let's see. And I've not been to the Upper Peninsula, so I can't really talk about this very much. But I've heard it's really beautiful. I'd like to go at some point. Any questions? Let me see. Any questions that you guys have for me? And I'll try to bring up the chat. Oop. Not sure how I stop. Hold on. There you go. Is there any questions? I know I went through that super fast, so.
I don't see any in the chat, but I think, would it be okay if I guess folks can unmute themselves if they have questions? We have a couple minutes.
Of course. Okay, so the chat is saying inpatient rotations in PGY2 split up. It's not 9 months straight, but there's only 3 months that you're not. So you'll usually be inpatient for 3 to 4 months at a time and then switch. But you do switch teams and attendings during that time. So you may go from, like, we have their initials basically. So it's team A, B, Rahman, which is one of our attendings. He's a private attending that we work with, and then a TBI rotation. So you do your 2 TBI rotations are back to back in your second year. Your first month is actually with a senior to help you kind of get used to it because it's a tougher rotation. So those are back to back. You won't be split. But they try to put like a consult month after that or neuropsych after that to kind of give you a break. But yeah, it's a tough year, but for several months, you're going to be inpatient straight. Our conference is yearly. They are yearly. Did that answer the question about the 9 months of inpatient? Okay. Trained physicians involved in training, you feel like you get a lot of exposure. I mean, I can't say as to other programs. I mean, this is the only program I'm in, but we do have a TBI specific floor. We have 2 attendings who have done fellowships in TBI, and we typically have a TBI fellow who's also here and in training. So, I mean, we see quite a few because we're associated with Dearborn, which is the level 2 trauma center. I'm on consults right now, and I would say probably 20, 25 patients on our list are TBIs that we're following right now, either to try to get them over to Beaumont Taylor for inpatient rehab or potentially allowing them to go home if they're able to do that. But yeah, we do see a lot of TBIs. how much sports medicine and sporting event coverage. So we do in the fall, we work with the high schools and we follow the high school football teams. And so we typically do 2 to 3 games with them, but they have to be home games. We follow a sports medicine physician on the field. We're not on our own, but we do have like a sports medicine trained attending there. That's kind of in the fall. If you're more interested in it, there's opportunities. If you want to do wrestling, it's a big kind of sport in this area. Hockey is another really big sport. I think this year, hopefully, we're going to be able to do a little bit more. We have been very limited by COVID, just because the kids have to be screened every day. We have to be screened. It's kind of and the sporting associations up here have really been struggling with COVID and how to run everything. So we're hoping maybe this year we'll be able to do a little bit more, but we'll have to see what they've got available. We do a month of we do 2 months of ortho, or I think 3 months of ortho, one in our first year, one in our third and fourth year. If you want to do more, there's electives that you can do. We also have attendings who are very MSK. They lean very heavy MSK, and that's kind of what they do in clinic. And so you'll see a lot of that too. I wouldn't maybe necessarily say we have a ton of just straight sports medicine rotations, but I mean, the attendings are always open to kind of doing that if you want to. Yes, a lot of our residents do go into sports fellowships. So we do a month with the VA. We do get some of our EMG training there, but a majority of our EMG training is actually with Dr. Mafia, who's our assistant program director, and Dr. Hong. They both do, I think one of my fourth years was telling me earlier this week that he got 35 EMGs in 1 week with one of our attendings. So actually most of it comes from our attendings, not the VA. Yes, there are opportunities to use OMM. We do not have a DO on faculty, but we do have our PM&R, like our IPR director, medical director, is a former chiropractor. So he allows us to do a little bit more. I'm a DO. So we're allowed to do it. We just kind of have to have approval from our attending. So there are opportunities, probably not as many as we would all like, but it does take a lot of time, which makes it hard to do.
Awesome. I think that might be all the questions.
I think so too.
Cool. Well, thank you so much for presenting.
Thank you.
Cool. And then if you want, you can put in, I don't know if there's like a point of contact, like a good email address that if applicants have further questions, if you want to throw it in the chat, that way people can just save it on
I'll
their
put
end.
my email in here so you guys can contact me. Normally our manager is on here, but she ended up, we've got a lot of people out with COVID, so.
Cool. Thank you so much.